Here is your question. Right, so if you have read and understood, considering a procedural skills station, kindly please begin.
Hello, I'm Dr. Faizan. I'm one of the surgical candidates. May I confirm your name and age, please?
I'm Smith, 33 years old.
Nice to meet you, Mr. Smith. Mr. Smith, today I've been asked to carry out a procedure which will involve me passing a tube down your urinary passage to drain your urine. You might be having a little discomfort when I pass the tube, but it won't be much painful. Is that okay with you, Mr. Smith?
Yes.
Mr. Smith, this can be associated with some complications like infection. Sometimes there might be bleeding, and sometimes there may be failure of passage of the tube. And also sometimes there can be bleeding from the during insertion of the tube. Is that okay with you?
Yes.
Okay. So I'll ask for the written consent if it is there. Is it available?
Yes.
Okay. Then I'll check the patient identity by checking the bracelet of the patient, and
Yes.
I'll check the WHO checklist.
Okay.
Mr. Smith, do you have any allergies?
No, not that I know of.
Okay. Are you on any medications?
No.
Okay. Now, if the patient has a vital chart, I'll check the vital chart. Mr. Smith, we'll be having a chaperone with me for assistance. Is that okay with you?
Yes, available.
Okay. Okay. So now I'll prepare the equipment. I'll ask my assistant to give me 2 sterile gloves and 3 gauze pieces and a sterilizing agent. I'll ask him to give me betadine or sterilizing agent. Then I'll ask him.
Yes, and
forceps and sterile drapes, and I'll ask him to give me a local anesthetic.
What would be the what would be the size of the urinary catheter that you are going to pass?
I'll use a 14 or 16 size catheter.
Okay.
14 size.
Yes. And then, what are the syringes? How many do you need, and do you need them empty or filled?
I need 10 ml syringe, 10 ml syringe filled with the distilled water.
Yes.
And a Euro bag.
Yes.
And a dish for collecting the urine.
Okay.
And then I'll position the patient flat on the bed. Then I'll start the procedure. So before
you'll explain the procedure to the patient in layman language as well. Please do so.
Okay.
Then you'll wash your hands. Yes.
Yeah, I'll wash my hands. I'll uncover the pelvic region of the patient. I'll expose him from the umbilicus to the knees.
Yes.
Then I will wear my gloves. I will hold the penis with my left hand and retract the prepuce and clean the foreskin with 1 gauze piece, then the glands with another, and the meatus with the 3rd gauze piece. Then I will instill the gel into the penis, local anesthetic gel. Then I will tell the examiner that I want to wait for 5 to 10 minutes for the gel to act, local anesthetic to act. Then after waiting, then I'll ask my assistant to give me the Foley's catheter. I will grasp the penis with my left hand, and I will insert the Foley's catheter, uh, and I will pass it all the way till the Y junction. Then I will put a kidney tray in between the legs to drain the urine.
Yes. And
If the urine, if I see urine coming out of the catheter, then I will inflate the balloon of the catheter with 10 ml of normal, 10 ml of distilled water.
yes. And
Then I'll also collect the sample for urine culture sensitivity and a microscopy. And after I'll attach the Euro bag, and I will replace the foreskin of the patient, and I will help him redress, and then I will dispose my all the equipments, the gloves and the syringes in a yellow bin.
okay, how many pair of gloves would you wear?
Two
And
pairs.
Yes, when would you take off your first gloves? And gauze, you didn't mention that. I was waiting. You'll tell me.
Yes, ma'am.
Yes.
First, I will take it off after putting the local anesthetic gel.
Yes, and when you are retracting the foreskin, then you'll change the gauze and the first gloves as well at the same time. All right. Can you please tell me what would you do if no urine drains after catheterization?
I will try to percuss the suprapubic region to
Yes.
see if the bladder is full.
Yes.
And I can also put pressure in the suprapubic region, or I can aspirate. I will aspirate with a syringe to so
First,
that
you apply suprapubic pressure alone. If that doesn't work, then you will do with the syringe. Yes, and then
if it still doesn't, if there is no urine, then I will consider using. I will.
flushing. Yes, with the 50 ml catheter syringe.
Yes, ma'am. It could be
Yes.
due to a blocked catheter. I will
Yes.
flush it, and if
Yes.
it still doesn't come, then I will consider calling a urologist.
Before you even go there, you should examine the patient's abdomen. So what would be your differential diagnosis before you call the urologist or consult urologist?
One cause can be that the patient is hypovolemic.
Okay, yes, and
It could be if the your catheter is in the urethra itself.
yes, so it has
the,
not even reached there, and
yes,
there could be colonic carcinoma which is inhibiting.
yes, there could be any carcinoma of the prostate, bladder,
Yes,
or the colonic carcinoma, or any pelvic collection or abscess.
when you're inserting or when you're trying to place all right, but I wanted to ask you, where is my question? When you're trying to sterilize the patient before you even insert the catheter, what are the things that you have to keep in your mind which can lead to immediate allergic reaction?
If the patient has any betadine allergy,
Or lignocaine
allergy or betadine
so
allergy,
what would you use instead?
I would use chlorhexidine.
Alcohol based agents, yes. Yes,
Alcohol based agents.
yeah, right. So Belvent, and we have done that adequately. Any advice you wanted to give to the patient after you've catheterized the patient and you've done your procedure? Because this
Yes,
is something that you have missed.
Yes, ma'am. Patient advice and documentation.
Yes.
Patient advice, I will tell him that if he has any suprapubic pain or complaints, he can contact the nurse, and also I think that's all.
Yes. Good. Okay. Thank you.